Welcome back to Downing Street for today's coronavirus briefing. Before we start, I wanted to let you know that today's briefing will follow a bit of a new format. Following significant demand, as well as questions from the media, we'll take our first questions from a member of the public. This is going to become a regular feature of these briefings. The questions are selected by an independent polling organisation. And just like the journalist questions, we don't see the questions in advance, but we'll give them the very best answers that we can. In the past few hours, since we announced this new approach, we've had over 15,000 questions submitted. And you can ask a question yourself by going to gov.uk/ask. And today I'm joined by Professor Chris Whitty and Professor Steve Powis, the Medical Director of the NHS. The government is working through our action plan, and at its core, the objective is to protect life and to protect the NHS, both by slowing the spread of the virus so that we flatten the curve, and by ensuring that the NHS always has more than enough capacity to provide critical care for all those who need it. According to the most recent figures, there have been 719,910 tests for coronavirus so far in the UK, including 37,024 yesterday. 157,149 people have tested positive. That's an increase of 4,310 cases since yesterday. 15,051 people are currently in hospital with coronavirus, down from 15,239 yesterday. And sadly, of those hospitalized with the virus, 21,092 have now died. That's an increase of 360 fatalities. And we must never lose sight of the human cost of coronavirus and the pain and the grief that it causes. And each death serves as a reminder that we must stand firm in our resolve. Sadly, these deaths figures include 82 NHS colleagues and 16 colleagues who work in social care. They dedicated their lives to caring for others. And I feel a deep personal sense of duty that we must care for their loved ones. Today I'm able to announce that the government is setting up a life assurance scheme for NHS and social care frontline colleagues. Families of staff who die from coronavirus in the course of their essential frontline work will receive a £60,000 payment. Of course, nothing replaces the loss of a loved one, but we want to do everything that we can to support families who are dealing with this grief. And as a government, we're looking closely at other professions that work on the front line against coronavirus, who also do not have access to such schemes, to see where this may be required. This crisis has shown this country values so much our health and social care workers. And I want to pay tribute to the perseverance of the British public, who even this warm spring weekend, in their vast majority, did the right thing and stayed at home to protect the NHS. Thus far in this crisis, at every single hour of every single day, the NHS has always had the capacity to treat the people who need that treatment. I'm glad to be able to report that there are now 3,190 spare critical care beds. Indeed, 42% of oxygen-supported beds in the NHS now lie empty. And in most parts of the country, the number of people in hospital with coronavirus is beginning to fall. One of the reasons NHS capacity has always exceeded need is because of our amazing programme of NHS Nightingale hospitals. Today, I was proud to attend, virtually, the opening of the 8th of our 10 Nightingale hospitals across the UK, again built in a matter of weeks. This Nightingale Hospital project stands as a monument to the nation's ability to get things done when it matters. This is one of the most ambitious projects this country has ever seen in peacetime. And I'd like to thank the NHS, the armed forces, and all the companies that have worked side by side to make these plans a reality. The Nightingale project is just one of the measures that's boosted capacity all across the NHS. By re-enlisting thousands of former staff, former clinicians, and enrolling early thousands of students, we've boosted the workforce of the NHS. And we've changed forever the digital capability of the NHS. I think many people who've now used online GP consultations and online outpatient visits won't ever go back. And I pay tribute to the staff who've worked in different ways to how they would ever have imagined, and who've been more flexible and open to change when it was really needed. So where there have been advances amongst these huge challenges of this crisis, we must not lose them. However, we also know that fewer people are coming to the NHS when they need to. A&E attendances have dropped to 221,000 emergency department attendances in the last week, compared to 477,000 in the same week last year. That's more than 50%. Now, some of this drop is due to lower road traffic and people following the social distancing rules. Some of it will be due to people accessing the NHS in ways that work better for them, like online or through pharmacies, and that's a good thing. But in some cases, we know that the drop is due to people not coming forward and using the NHS for critical things that matter. Our message is that the NHS is open. Help us to help you. So if you're worried about chest pains, for instance, maybe you might be having a heart attack or a stroke, or you feel a lump and you're worried about cancer, or you're a parent concerned about your child, please come forward and seek help as you always would. It is so important that everybody uses the NHS responsibly, and the NHS will always be there for you when you need it. Just as it's been there for us all throughout this crisis and throughout our lives. And as the number of hospitalizations from coronavirus begins to fall, I can announce that starting tomorrow, we'll begin the restoration of other NHS services, starting with the most urgent, like cancer care and mental health support. The exact pace of the restoration will be determined by local circumstances on the ground, according to local need and according to the amount of coronavirus cases that that hospital is having to deal with. Having written off £13.4 billion worth of historic NHS debt, I want to ensure that the NHS is always there in a way that doesn't just help us recover from coronavirus as a country, but also puts us in a stronger position for the future. We're coming through this peak. We'll honour those who've dedicated their lives to caring for others. But it will count for nothing if we let things slip now and risk a second peak. I know that lockdown is hard for so many people, but let us all have the resolve to see this through. So please, stay at home, protect the NHS, and save lives. We're now going to go to Professor Chris Whitty, the Chief Medical Officer, for the daily data charts, and then we're going to take questions from the public.
Thank you very much, Secretary of State. So just the first slide is just a reminder to people of the 5 tests for adjusting the lockdown. The first 3 of which are about the epidemic, that the NHS has capacity to provide critical care across the UK, a sustained and consistent fall in the daily deaths overall from coronavirus, and the rate of infection decreased to manageable levels across the board. Then there's an operational point about operational challenges, including testing and PPE in hand with supply able to meet future demand. And then finally, and importantly, confident that the adjustments to current measures will not risk a second peak of infections. Next slide, please. The next two slides are really ways of looking at whether people are continuing, as they have been consistently throughout this crisis, to heed the guidance in terms of keeping pressure off the NHS by staying at home unless they have to go out for necessary things. And as you can see, after a very remarkable fall initially, broadly this has been flat, very slight trending up in terms of motor vehicles, but otherwise really the data remain largely unchanged on these transport metrics. Next slide, please. And then looking at other forms, the driving we've talked about before, a very slight increase in walking, public transport remains largely flat. So evidence, I think, that the great majority of people are continuing to honour the lockdown, which is helping us to drive the number of cases down and therefore take pressure off the NHS. Next slide, please. The next few slides are really ones that people who watch these briefings will be very familiar with. It's just the most recent data. So new cases in the UK. As you can see, obviously one thing we have to bear in mind is the number of tests is going up overall, but despite that, the trend is flat or slightly down in terms of positive cases. Next slide, please. But when we actually look at people in hospital, I think the trends that demonstrate that over the country as a whole, we're going through the peak are reasonably clear to see. Obviously, a bigger fall in London, but the rest of the country in different areas either flat or decreasing over time. Next slide, please. And then when we turn to one of the most important questions, which is critical care capacity, if you look at these trends across England, Scotland, Wales and Northern Ireland, these are the percentage of all critical care beds being used for COVID patients, and both in absolute and in relative terms, this is gradually trending down. But importantly, and I talked about this last time I was here, this is a very gradual peak. We're not seeing a dramatic fall off, and nor do we expect to in the next short while. Next slide, please. And finally, sadly, people are continuing to die. As we have said every time just after a weekend, there's an artificial drop because there's less notification over weekends. So the number of cases who sadly were reported as having died yesterday was 360. I do actually expect there will be a bit of an uptick again later in the week as we catch up from the weekend drop. Nevertheless, the trend overall, as you can see from the 7-day rolling average at the top, which smooths out these weekend effects, is a gradual decline, but we are definitely not consistently past the peak across the whole country at this point in time. Finally, a slide which compares different countries, and again I would be really clear that we should not overinterpret the absolute numbers. The way these are actually measured in different countries is different, but the trend lines I think are reasonably clear from this. Thank you very much.
Thank you very much, Chris. And now we're going to go to the first question, which is from Lynn in Skipton, and I'm going to read out the question, and I'm reading it for the first time, and then we will endeavour to answer it. I'm missing my grandchildren so much. Please can you let me know if after the 5 criteria are met, is being able to hug our closest family one of the first steps out of lockdown? Well, thank you, Lynn, for that question, an incredibly important one, and brings home the emotional impact of the lockdown measures. I think, why don't we take the direct medical evidence from the Chief Medical Officer?
Well, very clearly, for most people, the ability to actually interact with families in a way that they have not been able to during this period is absolutely essential. In terms of the direct answer to this lady's question, it depends, if I'm honest, on the situation that she finds herself in. So if she is someone who has a significant medical problem in a way that means that she would have to be shielding, that is, and she's an older person, some grandparents are younger grandparents, some obviously are older. If she's in a group which is vulnerable, then the answer is that it might well be prudent, and this will depend entirely on individual circumstances, for her not to get into a situation where she is putting herself at risk. Obviously, if she's healthy and younger, that may well not be true. But the overall view that actually one of the things that clearly is important to everybody is the ability to get together with families remotely, but also physically. Everyone fully accepts. Nevertheless, it is important that people who are vulnerable continue to be protected even after whatever the next steps occur.
Thank you. And the thing I'd say to Lynn directly is that we understand the impact of not being able to hug your closest family. It affects all of us too, as well as the direct health impacts of the lockdown, bringing down the curve and trying to stop this terrible disease, and also the economic impacts, which are clearly very significant. There are also the direct emotional bonds, because it's one of the most natural things in the world to want to hug a member of your family, and we just hope we can get back to that as soon as possible. And the best way we can get there fastest is for people to follow the rules, so we can get those 5 criteria met as soon as possible. I don't know if you wanted to add anything.
Only to add that we all know how hard this is. My own mother lives hundreds of miles away, and I know she's wondering when she'll be seeing me and her grandchildren again. This is really tough, but as the Secretary of State has said, it is bearing fruit in that we are seeing reduction in the number of hospital admissions, we're seeing a reduction in the number of deaths, and it's only by the British public continuing to comply with that guidance until the time is right that we will all continue to see a reduction in deaths, which I know has touched so many people around the country in terms of loved ones.
Thank you very much, Lynn, for your question and for submitting it. And I hope that I think that's shown that the questions from the members of the public can be just as informative and can be just as difficult to answer as questions from journalists who are trained to ask them. Talking of which, Hugh Pym from the BBC.
Thank you very much. Question for the Secretary of State. It's about testing, particularly important in the short term, at least for up to 10 million key workers and their families. We're hearing varying reports on how easy it might be or not to book tests online. What do you say to that? And do you think you will hit your target of 100,000 tests a day by the end of this month? That's later this week.
Well, thank you. I think we are on track to the 100,000 target. We're broadly where we expected to be. You've seen a big increase over the weekend to 37,000 tests yesterday. Now, we are also enhancing and making it easier to access how you get hold of tests. The home tests have been particularly popular. We delivered 5,681 of those yesterday. That is all about being able to make the testing as easy for people who, if you've got symptoms, you're by the nature of the thing, you are already ill. And so we want to make it as easy as possible to get hold of those tests. Alongside it, still we're opening more and more drive-through centres. So we're broadly where we expected to be. And we've got a lot of work the rest of this week to keep continuing the ramp up to the goal that I so clearly set out. Thanks, Hugh.
Can I ask a follow-up?
Yes, of course.
Beyond this, it's very important to escalate testing capacity significantly to prevent or help prevent a second spike. Where do you want to be with capacity and testing ability in a few months' time? How many thousands, hundreds of thousands a day?
So this is a really important question, and of course, the reason that I set the goal and that we're working so hard towards it is because testing is an important part of how we keep the spread of the virus down, especially once we've got the number of new cases down through the social distancing measures. So we want testing to continue to increase. As you'll know, the Prime Minister set a goal of 250,000 some time ago, especially for when the antibody tests come on stream. But so far, there isn't one of those that is clinically valid. So we'll keep on increasing. It's important to note that we've already gone past the number of tests per day, for instance, that they carry out in South Korea. We're approaching the levels that Germany undertakes. So, it's a project to keep increasing. Also, we need to think very hard and take the clinical advice on how to use those tests. For instance, we're putting far more into care homes. We're making sure that now NHS staff get tested, including when they're asymptomatic, to make sure that we understand whether people who are working in hospitals have got the virus, and using the tests for surveys. The Office for National Statistics have got a survey, for instance, in the field right now, with people being tested this week to find out how many people have got the virus, how many have had the virus, the critical questions that we need to know the answers to. So I don't know if you want to add anything, Chris, but the point is it's a really important question because because testing is a critical part of controlling the virus once we get the number of new cases down.
Only thing to add is that the more testing capacity you've got, the more flexibility you have to do different things, which both for patients and in terms of things like care homes, as the Secretary of State was saying.
Thanks, Hugh. Robert Peston, ITV.
Good afternoon. On the life insurance scheme, will overseas healthcare workers working in the NHS and those who come back to the NHS temporarily, will they qualify for this life insurance? Right now, they don't, for example, qualify for normal death in service benefits. And a question, I think, largely for Chris Whitty. More or less the most important test you've set is that the transmission rate, the so-called R, has to fall to 0.5. So, in language you can all understand, on average, it would take 2 infected people to infect one other person. What's the magic of that 0.5? Why does it give you comfort? And also, since we still don't know how many people are walking around with funny symptoms or no symptoms at all who have the virus, how can you be remotely confident that you will get there? Neil Ferguson said he thinks that the number is currently 0.6 to 0.7, but how can we possibly be confident of that?
I'll take the first question, Robert. The answer is yes, this is for frontline staff working in the NHS and in social care who die and are employees within the NHS and social care. And as I say, we're also looking at which other groups of key workers that applies to who don't have a scheme already in place. Chris?
On 0.5, can I just correct? I mean, I don't recall ever saying that the target was 0.5. What I have said is that it's in the range 0.5 to 1 at the present time, probably somewhere in the middle of that range. And the second thing which I have said is that it is really important we do not go above 1. That 1 is an absolute target, and the reason for that is that once it goes above 1 for any prolonged period of time, I mean, it might just flick up for a short period, then you go back to exponential growth, and then sooner or later, depending how much above 1 it is, you get back to the situation the NHS is threatened to be overwhelmed because exponential growth goes from very small numbers to very large numbers very fast. So I would like to clarify that it's not going above 1 is the long-term target. Clearly, the lower we can get it at the moment, the better. But as I say, it's probably in the middle of the range, 0.5 to 1 at the present, and that is bringing down the R, which is what you're actually seeing when you look at the critical care and other metrics we looked at in the slides.
Thanks very much.
Could I just,
yeah, of course.
One extra thing, actually, just on the life insurance. And just to be clear, there's nothing in this life insurance scheme that would waive the rights of the families of individuals who get COVID and either die or are seriously injured from, in a sense, suing the NHS in the traditional way if they feel they haven't been properly protected, particularly in the absence they might feel of appropriate PPE gear. There's no waiving of their standard employment rights involved in any of this.
No. Beth Rigby from Sky.
Thank you. Professor Whitty, at the beginning of the lockdown, Sir Patrick suggested a death toll below 20,000 was a good outcome. Now hospital deaths are sadly above 21,000, and that doesn't even include care home or community deaths. How have you had to change your expectations as the disease has progressed? And can you provide an updated expectation of what you think a more realistic number is now? And Secretary of State, you've promised 100,000 tests by Thursday, and last week you said trace and track was key to easing social distancing measures. What level of testing do you need to get track and trace up and running, and what's your time frame for that?
Yeah, go ahead.
So on the first one, the number will definitely exceed 20,000. So even with hospital deaths, as you say, sadly it has gone above that. Once we look into direct and indirect, and I constantly make this point, but it is really important, direct and indirect deaths all cause mortality. We definitely, sadly, do expect it to exceed that. I think that my view actually is we need to view this epidemic over the long run, and this has got a very long way to run. I'm really cautious about putting out, and I've said this again repeatedly, these kind of absolute numbers, because this could go in a lot of different ways over the next many months until such time as we have a clear exit that has a vaccine or drugs or some other route that allows us to be able to say, look, we now can stop people dying from this. And this is going to be true, to be clear, in every country around the world. So I'm really cautious about putting these absolute numbers, but I am absolutely clear also that the 20,000 number is not where we will be once we add in the direct and indirect causes both in and out of hospital.
And on the question on test, track and trace, it's all a matter of degree. The lower the number of new cases, the more effective a system of test, track and trace of any scale is. And therefore, 100,000 tests a day is a big enough testing system to start test, track and trace. But if it's bigger, then the system can work on a higher number of cases and be more effective. South Korea is a really good example where they peaked in terms of tests a day at just over 20,000. And they've now brought that down because their number of new cases is so much lower. They can test everywhere they want, and they still don't need to use up all of the tests that they have the capacity for. And we've seen over the last few weeks the gaps between capacity and the number of tests done in this country as well. And I noted, on Sunday, the new German ambassador to the UK was explaining that there's the number of tests, the test capacity in Germany is 800,000 a week, and they use 450,000 of that capacity each week. So we have a similar pattern of capacity being higher than tests used all around the world, and the capacity that we're building is big enough to get started on test, track and trace. We need to get the track and the trace part of that up and running so that they can be effective as we bring the number of new cases down.
Can I just follow up just on one thing, Professor Whitty? Just quickly, what explains the mismatch between where you thought the death toll would be at the beginning of the lockdown and where we are ending up at a month in? What changed over the course of the past few weeks?
I've never put an absolute number into the public domain. I've been asked this lots of times. My aim has always been to try and get the number to be the minimum we can manage. But to be clear, this has got a very long way to run. And I think just thinking about the first peak, which due to the fantastic work the whole nation has done and the work of the NHS, we have actually managed to go through. We've still got some way before it's falling right off, but there is a long, long way to go beyond that. And I think it's a big mistake, in my view, just to consider just the first phase. We need to look at the epidemic as a whole.
Thanks very much, Beth. Gary Gibbon from Channel 4.
Professor Whitty, could I follow up on what Robert Peston was asking about on the infection rates? If we are in the middle of the 0.5 to 1 range, will that do? is that good enough? Or is it actually the rate that you need to give clearance to a relaxation of the rules is lower than that, is perhaps around 0.5?
Well, I think there are, I mean, clearly the lower the R, and just to remind people who don't watch this programme the whole time, this is if R is 1, one person gives it to one person and the disease is stable. If R is 0.5, 10 people give it to 5 and so on, it's going down. And if it's 2, one person gives it to 2, gives it to 4 and so on. That was just a clarification for people watching. The further away the R is from 1 on the downside, so the closer it is, well, the lower it is, the better, for 2 reasons. The first of which is that it will mean that the peak will fall away faster and will get down to small numbers at a quicker rate. That's a good thing, clearly. But the second thing is the larger the gap between where the R is, the current force of transmission, and 1, the greater room for manoeuvre there is in terms of trying to think through when ministers have to look at things in terms of what could be reintroduced without threatening the risk that we could go back above 1 and start going back to exponential growth. So we know what we've currently measured indirectly, but I think that there's a reasonable degree of confidence that it's in that broader range, 0.5 to 1, and I think it's probably in a rather narrower range in the middle of that. Obviously, if it was lower, that would give us more room for manoeuvre, but it gives some room for manoeuvre, but it doesn't give a huge amount of room for manoeuvre, and that's one of the things that we ministers are going to have to consider, is how to actually make sure we keep the R below 1, given where we are at the moment, thanks to what everybody is doing. But, you know, there isn't a magic number here. Lower is better, but it's not that there is a specific number that has to be the right number.
May I ask a quick supplementary? What's your current estimate of what R0 is measuring in hospitals and care homes?
I think at the moment it's quite difficult, and it's quite difficult to separate those two out. My expectation is that it is very clear it is falling in hospitals. Where it is in terms of care homes, I think, is less easy to work out at this point. We've got ONS data coming out tomorrow, which may help a bit, but we're not measuring that directly, I have to say. And what I think we're seeing across the country is some care homes where there are significant outbreaks and other care homes which are unaffected. They're not kind of, it's not like the community are, which is much more heavily influenced by the whole of the population. It's much more local to particular areas and particular care homes.
And maybe Steve could answer on the NHS point.
So in hospitals, it's clear that the number of people who are testing positive in hospitals is falling, and therefore infection rates are falling. We would expect that because we're now in a position where the community spread of the virus is less, and therefore that will translate into lower spread in people coming to hospital and therefore in hospitals as well. As Chris said, I think care homes think differently in terms of approach to that, but in hospitals it's clear that the infection rate is falling.
Thanks very much, Gary. Sebastian Payne of the FT.
Thank you very much, Mr. Hancock. There were reports over the weekend that in the second phase of fighting the coronavirus, the government is planning to quarantine people arriving in the UK for 14 days. I was wondering what changed your mind about tighter border restrictions, and does that mean you're going to be encouraging British families to holiday at home this year? And if I can ask a question for Professor Whitty, could you give us an update on antibody testing, please, and whether the government has seen any breakthrough in its assessments for those tests?
Thanks very much. On the borders, we've been very clear that we follow the science, and given the current level of infections, level of new cases in the UK, and the very low amounts of international travel that's going on right now, it is clear that the impact on the epidemic as a whole of the number of people coming through the borders as a proportion is very low. But as we bring the number of new cases down in the UK, that proportion coming from those who are travelling internationally will rise. And that means that the judgment on the measures that you need at the border changes. And we've seen a number of countries go through this process, and we'll have more to say about it in due course. On the testing point, I don't know whether you want to go into that, but the antibody tests is still something that we work on. We have now lab-based antibody tests. In fact, in the field now, the Office for National Statistics survey is based on lab-based antibody tests. But we're yet to find what's called a lateral flow, which means a test you can take. You don't need to send the sample to a lab because it gives you the result on the stick. We're yet to find one that has a clinical level of results that we're confident in.
I mean, my view is that science very seldom moves forward by breakthroughs. It moves forward by small incremental changes that over time significantly improve things. That is what I think will happen with this antibody test. We currently have tests that are good enough to give us a first pass at a ranging shot on surveys, to give us a feel for how many people in the community overall may have been infected, some of them without knowing it. Because there's certainly some transmission without people actually getting symptoms. But an antibody test that is good enough actually to be able to say to an individual, we're confident either yes, you've had it, or we're confident no, you have not. We have not yet got to that stage, and I think it's unlikely to happen in a single leap. It's likely to happen in a series of small improvements that get us to a point where we feel sufficient confidence we can do that.
Thank you. Mr. Hancock, could I just ask a follow-up, please?
Sure.
You mentioned earlier you were encouraging people that if they've got heart pains or are worried about serious illness to go to hospital. Has the government done any work to measure some of the health side effects of the lockdown, such as its impact on mental health or domestic violence? And will that play any part in your decision on how to ease the lockdown measures? Thank you.
Yes, we have. And one of the striking things around the world is that far fewer people are coming forward to use health services, including here. Far fewer people are coming forward to use non-COVID services in the NHS. I'll ask Professor Powis to elaborate, because he's been doing a lot of the work on this.
Yes, so Secretary of State said, and as Chris said earlier, one of the things that we have concerns around are the indirect deaths, i.e. deaths and harm that is not related specifically to infection with COVID-19. And that's why for some weeks now we've all been reminding everybody that if you do have a condition which might be a heart attack, chest pain, symptoms that might be a stroke, then don't forget that the NHS is still there for you. The emergency services are there and always have been there throughout this. And also these are conditions where it's important not to wait, because treatment, diagnosis and treatment, speed is of the essence, and we can do many things for those conditions now, but we need to do it quickly. So the message to the public is come forward. The NHS is working if you have a sick child, if you have those symptoms. I think in the long term, we will only be able to tease this out as we start to look at excess deaths overall. Chris has mentioned that, I think, earlier today. And of course, comparisons between countries in terms of excess deaths will be important as well. But we do know that attendances in A&E departments are down. There are reasons that that might be the case, but there are reasons why we want to encourage people to come forward if they have emergency symptoms that might need emergency treatment. So I think it will become clearer over time, but the key message for the public is the NHS is there for you. Come forward as you always would if you've got symptoms or one of your loved ones has got symptoms that might need emergency treatment.
Thanks very much, Seb. Gordon Rayner from The Telegraph.
Thank you, Secretary of State. Professor Whitty, you said in March that children only got mild symptoms of coronavirus, which you said was a silver lining. While Sir Patrick Vallance said closing schools would have a minimal effect on the spread of the virus, so it was safe to keep them open, and there was zero chance of children avoiding contact with each other anyway. To what extent has your advice on sending children to school changed? Have you worked out the effect on the R value of sending children back to school? And also, do you believe that children can spread coronavirus to other children? Following reports at the weekend that perhaps they couldn't. And just very quickly, Secretary of State, you've just announced good news for a lot of people that hospitals are going to start taking in cancer patients and doing other non-emergency work. Can you give us more detail on that? And would people be watching this be wrong to interpret that as the start of an easing of the lockdown?
Chris, do you want to take the first one, and then I'll ask Steve to comment on
Yeah,
it?
It remains the case that the great majority of children either don't get coronavirus, or if they do, the symptoms are minor. That doesn't mean, sadly, that that is absolutely true. There are still a small number of cases, including some very severe cases, but they are relative to adults much less than they're much less than adults. So that remains absolutely the case. So the first reason for not sending children to school, which is it's particularly dangerous for them, that wouldn't be true in the case of coronavirus. Secondly, there is no doubt that they contribute. If you have schools open, it does contribute to increasing the R. So if you close schools, the R goes down. It's part of the collection of things that were done in March to try and pull the R from where it was near 3 to where it is now below 1. It's only one of. If you did it just on its own, it wouldn't be enough. But if you stopped doing it, you would actually lose some of the benefit that we've currently got. Now, there is quite a debate at the moment around the world in science. What contribution do children make to the actual spread of this virus between families around the country, wherever we're talking about? And is it different, for example, between young children and older children, which it may be? But unfortunately, we do not yet have direct data that really help us. Remembering that this is a new disease, so we can give a reasonably accurate answer for a disease like flu. We really understand how children help drive flu. We're still really learning on this one. And so whilst I think it remains the case that we think that the contribution of children at school to the spread of this virus is probably less than, for example, for flu, we do think it certainly contributes, and what we're trying to work out is what proportion of the R it contributes, and therefore, if children went back to school, how much closer to 1, and that's in a bad way, would we be, and could it even tip us above 1, and what can we do, if so, to try and minimise that? So it's a very good question to which there is unfortunately not a really clear answer, but we are getting closer, I think, to having a slightly narrower range of uncertainty around this.
Thanks, Chris. On the restoration of the NHS, we've always said throughout that people should come forward for medical treatment. So people's access to the NHS, access to medical treatment, has never been locked down. Indeed, it's one of the 4 reasons that you should leave your house if you need to. And what we can do, though, is because we now have the capacity in the NHS to be able to start reopening some services, we can do that. And I'll ask Steve to answer the question about with more detail, but it will be locally determined according to what capacity there is locally. But our message to people watching this and reading the Daily Telegraph is that the NHS is open and there to help you, as it always is. And so people, if they think they need medical treatment from the NHS, then they should come forward in the first instance by phoning up their GP or going to their GP online, calling 111.
Yes, so as the Secretary of State says, we are now in a position to start undertaking some of the services that we may have had to have stepped down to manage the surge in coronaviruses, or occasionally where services have become disrupted. So, for instance, I know cancer patients, there may be good clinical reasons why treatment might be delayed during a time when there is a lot of circulating virus in the community. And again, as we've both said, emergency services have been there all along, and it's really important that people access them. But I think, to answer your question directly, it's not at all a sign that the lockdown is about to be relaxed. In fact, I think it's the reverse. It's a sign that the lockdown and the measures that have been taken and the fact that everybody's following them has meant that we are now seeing a decline in patients in hospital with COVID-19. And it's exactly that that is providing the capacity once again that means that we can get back to restarting services such as elective surgery. So I think the message shouldn't be now is the time to relax. The message should be that by continuing to comply with these instructions, it will continue to help the NHS as we start to get over the peak and the plateaus, to a point where we can get much more back to the services that unfortunately we've had to delay over the last few weeks as we've managed this surge.
Can I just ask a quick?
Of course, yeah.
Just on the schools question, I mean, listening to that answer that Professor Whitty gave, a lot of people, I think, listening to this would interpret that as meaning that there still isn't really a plan in place for how schools are going to go back. Would it be wrong to infer that from what you're saying?
Well, Chris, I'll just say, what I'd say is it's still, as we've said over and over again, too early to make decisions on this, and people should follow the social distancing rules of staying at home to protect the NHS and save lives. And in a way, what we've been saying today about the restarting of many of hospital treatments, NHS treatments, and the encouragement of many people to come forward when they haven't been coming forward with non-COVID health problems, is all part of protecting the NHS, which has been made possible by the fact that we've flattened the curve thanks to the social distancing measures. So it should be seen in that light and that context. But on the school specifically, Chris, do you want to answer?
So I think when starting with the obvious point that obviously the final decisions will be for ministers, and this is not a scientific decision. But what we can contribute from the science side is to say, well, look, we've got this room for manoeuvre between where the R is now and 1. And there's a lot of things that are contributing, which everyone's doing, to putting that down. Schools are contributing some of that, and it may be different between different bits of schools. And what we're trying to do, very, very short order, is try and give a kind of feel for what are the combinations of different things which actually still keep the R below 1, which is an absolutely critical thing, but allow opening up of different bits of society and different bits, which schools is 1. But I think the decision about how the different combinations go together, that finally is one for ministers. And I know the Secretary of State will completely agree with that. What we can do is help provide some data to help say, here are some combinations of things we can do. But, and I really want to be clear about this, there is no perfect solution where we're going to end up being able to do all the things that people want and at the same time keep R below 1. So there are going to have to be some very difficult choices between different things, all of which, ideally, all of us would love to open up, but we can't do them all. And therefore, there will have to be some difficult choices, and choices around schools clearly will be one of those.
Is that okay, Gordon?
Yes, thank you.
Great. We've got David Walsh from the Sheffield Star.
Hello, Secretary of State. Raise the Bar campaign wants to increase the threshold for the £25,000 retail, hospitality and leisure grant from £51,000 rateable value to £150,000. In Sheffield City Centre, this would mean a further 157 businesses could benefit from additional £3.9 million of support. This would save businesses and jobs. Can this be actioned? And a second one for the Secretary of State, please. Sheffield is famous for its independent breweries. It has more per capita than anywhere in the country and was enjoying a golden age prior to the crisis. The government support grants have bought them time, but with no opening date yet for pubs and bars, their very existence is under threat. To get them back on their feet, will the government cancel beer duty for 6 months when they're allowed to restart operations?
Well, thanks, David. I understand, especially coming from a small business background myself, just how important these questions are to the businesses in the centre of Sheffield and the breweries, which have, as you say, been flourishing right across the country over the past few years, and have obviously been very hard hit by social distancing by its nature, which takes away the ability to go for a pint with friends. So I will take these away and talk to the Chancellor about them. What I would say is his announcement today of 100% guaranteed loans for smaller businesses is another important step in supporting businesses to get through this. We recognise the importance of supporting businesses right across the board, whether they're in a town centre, breweries or others who are badly hit by this. Supporting businesses through it is critical, because both the health impact of the measures and the economic impact are both best served by people staying at home, because that saves lives, but we'll also get the rate of transmission down as fast as possible, which will then allow us to get through this as soon as possible. So we want to get through it as soon as possible, and we want to support businesses on the way through. And those two specific ideas, it's tempting to say yes to as Health Secretary, but I think I need to talk to the Chancellor. Thanks very much. Dave West from the HSJ.
Hi, thank you. First question for Mr. Hancock. Could you tell us a bit more about the restoration of services, general planned services in the NHS? There are millions of people on the waiting list for general operations or appointments, hip replacements or cataracts and things. When would you expect, what sort of time frame would you expect that kind of general activity to be getting back to normal? Might it be region by region, and what role do those Nightingale hospitals have to play in that, which you mentioned? And the second question, if I can, for Chris or Stephen. This morning, HSJ revealed the warning to doctors about the small numbers of children who are becoming seriously ill with an unusual set of symptoms, which the experts believe may be an emerging symptom linked to coronavirus. Do you think this may be a new feature of the outbreak, or are you pretty confident that these are simply cases of the small, very small number of serious cases of coronavirus which we do see in children?
Thank you. I'm very worried about the latter, and we are looking into it closely. I'll ask Steve to answer on that. On the restoration, this will be a locally driven approach, system by system. Of course, the principles are that the most urgent treatment should be brought back first, and also that it needs to be according to the local demands on the system. You know, there's parts of the country where the number of COVID patients as a proportion is much lower than in other parts. And so it has to be locally driven. That means, unfortunately, I can't give you a sort of concrete single number answer to when. And it is gradually over weeks, but starting from tomorrow. Steve.
Yes, thanks, Dave. Yes, so as you've referred to, we have become aware in the last few days of reports of severe illness in children, which might be a Kawasaki-like disease. So Kawasaki disease is a very rare inflammatory condition that occurs in children. The cause is not often known. It can be related to a number of things. So it's only in the last few days, as I say, that we've seen those reports, and I know you reported that in the Health Service Journal this morning. So both Chris and I are aware of that. We have asked our experts, so I've asked the National Clinical Director for Children and Young People to look into this as a matter of urgency. I know the Secretary of State is concerned, as he said. I know Public Health England are also looking into this. So it's obviously important that when clinicians see these cases and worry that there might be a cluster, that they alert other clinicians so that we can make sure that they are identified if they're occurring elsewhere. And then quite rightly, we ask our experts to look into them and to see whether they can establish any link. We're not sure at the moment. It's really too early to say whether there is a link. But what I should say, as we said already this afternoon, is our advice to parents is that this sort of disease is very, very rare. If you are worried about a child who is becoming sick and not recovering, then do remember to contact 111, talk to your GP, or in an emergency, contact 999, because the emergency services in the NHS are there for sick children, and it's important for this and other conditions, although very rare, I must emphasise rare, that you come forward to seek treatment and diagnosis as quickly as possible.
Thanks, Steve. Chris Whitty.
I'm just ready to reinforce what Steve said. This is a very rare situation, but I think it is entirely plausible that this is caused by this virus, at least in some cases, because we know that in adults, who of course have much more disease than children do, the big problems are caused by an inflammatory process, and this looks rather like an inflammatory process, a rather different one. But therefore, given that we've got a new presentation of this at a time with a new disease, the possibility, it's not definite, we need to look for other causes as well, but the possibility that there is a link is certainly plausible. But back to Steve's overriding point, numbers very small. Key thing is, if parents are worried, then phone up and get advice. It's very rare.
Ask a very quick follow-up on the restoration.
Yes.
The NHS needed to free up about 30,000 beds to ensure it was ready to deal with the first peak, and has been able to do so, but has used a lot of capacity and that's rearranged a lot of things. How many is it going to need to keep open in case of a second peak or other returns of the virus? Because that's clearly going to be a big constraining factor, along with the staff who staff the beds, on what it can do back to normal.
Well, one of the principles of the tests we've set before we make any adjustments to the social distancing measures is that we shouldn't risk a second peak. For many, many reasons, the direct impact, of course, but also because a second peak would mean that we would have to halt the restoration of the NHS for non-COVID treatments. And that has an impact itself on the health of the nation, as Chris Whitty first set out several weeks ago, in terms of the indirect death rate. So we've got to make sure that we don't have that second peak. Therefore, the NHS is, of course, making sure that it can reopen where that locally is appropriate, given the local amount of pressure on the system, and also taking into account the Nightingale hospitals. In fact, I'm going to answer a question that was asked previously, but by Beth Rigby, I think, but I didn't answer, which is that the Nightingales are not going to be used for non-coronavirus purposes, because they are precisely set up and designed to deal with people who are intubated and are sedated. But the fact that they're there does help us to restore more of the core NHS and get that going as much as possible. Were you coming in again?
I was just going to say, very finally, would you see them all, the Nightingale hospitals, all 7, or I think it's 7 or 8 now, to be used in that way?
In the first instance, yes, but as we go through this, we always keep things like this open to review, to work out what's the best way to use the resources at the nation's disposal. Steve?
Yes, I think the Nightingales specifically have been a very important part of the flexibility that the NHS has put in place to manage the surge. Remember, it's only a few weeks ago that we were really concerned that we would see a surge in patients, particularly those that needed critical care, that would go beyond even the surge capacity we could put in place in our existing critical care facilities by surging into theatres and recovery areas. So the Nightingales, I think, are a real proof that the NHS can be agile and flexible and can change its model of care in a very short period of time. Clearly, we want to keep them there because although the peak is reducing, we still feel that we need to have them there as the insurance policy that for COVID patients. But as we go forward, we will be keeping them under review, as the Secretary of State has said. And of course, we're only into the first week or so of coming off a plateau and a peak. And as you would expect, all that work, again, as the Secretary of State has indicated, is being done at the moment to plan capacity going forward. And the restoration of services is a really important part of that, which I'm absolutely sure will occur hospital by hospital and region by region, because infection rates are a bit different everywhere, and because different organisations have stepped up to manage the surge in slightly different ways. But the key point is that we are now in a position to bring those services increasingly back on stream.
If you'd asked me a month ago, Dave, whether we would be having this discussion now about the restoration of those parts of the NHS that we had to pause in order to put capacity towards treating coronavirus, and the question is, how much NHS capacity do we need to keep in hand in case there's a second outbreak, which we don't want to risk? I would be, and that the NHS had not, in the meantime, been at all overtopped by demand in any instance, then I think we'd be. If you told me that a month ago, I would be very pleased with where we've come to on the NHS capacity, because that is absolutely core to the principles of this country, is that if you need NHS treatment, then you get it. And we've managed to keep that principle throughout this vast crisis. Okay, thank you very much indeed. That concludes our Downing Street briefing for today.